Keeping the airway clear for children with cystic fibrosis is very important. In this video, we're going to discuss 2 ways that you can do this. These are chest physical therapy, or CPT, also known as hand-chest physical therapy, and an oscillating positive expiratory therapy device. In this video, we'll use one called an Aerobic. Let's begin with hand-chest physical therapy. The purpose of hand CPT is to get the mucus moving so it can be coughed up and removed from the lungs. You want your child to be as comfortable as possible, so technique is important. Cup your hand so it's not flat. Your fingers should be held firmly together in a slight curved position, creating a pocket or a cup in the palm area. We want the outside of the hand to be the only area that makes contact on the child. When you're doing it correctly, you'll hear a popping sound that creates movement of the mucus and cilia in the lungs. This technique can be practiced on your own thigh or chest to get a good rhythm and to make adjustments for comfort before starting on your child. Now, let's get started. First, make sure your child has not eaten within 1 to 2 hours because any chest therapy may upset the stomach and cause nausea. Remove all jewelry, watches, and so forth that may interfere with the therapy and cause pain to you or your child. Next, use a shirt or a thin blanket or towel to cover the area that will be getting hand-chest physical therapy. Have your child sit in a position so the head stays elevated. Positions of hand CPT can be adjusted by age. Older children can go through hand CPT in both elevated and upright positions, while younger patients may only tolerate a slightly elevated position. It's important to keep the head elevated in younger children and not let them lie flat on the back because this can cause reflux, aspirations, or nausea. Feel where the ribs are located. They're directly over the lung area, which is where you want to perform the CPT. Try to stay clear of the sternum, backbone, stomach area, and be cautious to avoid any area where a port or another medical device may be located. Now, divide the body in half from right to left. Your hand size and the child's size will determine the areas you will cover and the time it takes to do the CPT. Start on the front upper right side and continue in the same area for 2 to 3 minutes before shifting down or moving to another area. If your child is old enough and can follow directions, tell them to do a few huff coughs and deep breaths as you change positions and move downward. This will help move and remove mucus. To do huff coughs, have a tissue, cup, or garbage can for spitting out mucus that is coughed up. Here's how to do huff coughs. Your child should sit up straight. Tilt the chin up slightly. This will help open up the throat. Open mouth and take a deeper than normal breath and hold it 3 seconds. This lets air get behind any mucus deep in the lungs. Next, blow out evenly, as if trying to fog up a mirror. Keep blowing out a little longer than normal. Blow out until just before your child feels like coughing and have them try not to cough. Repeat all of these steps 2 or 3 more times. Now have your child try to cough normally to get rid of the mucus and spit it out. It's important for your child to participate in huff coughs and CPT to the extent that they can. End the right side CPT on the back area by feeling where the ribs are, avoiding the spine, for 2 to 3 minutes. Remember to ask your child to huff cough and take deep breaths. Then repeat the process on the left side. The second method for clearing the airway is by using a type of device with a complicated name, an oscillating positive expiratory therapy device. There are several kinds of these devices, but in this video, we're going to discuss how to use the Aerobica because it's easy to clean and disinfect. It's important that your child is able to follow directions in order to get the most benefit from this therapy. Here's how it works. When your child breathes out into the device, it gives back a bit of pressure or resistance to help hold the airways open. At the same time, it oscillates to help shake the airways and shake mucus loose. There are different levels of resistance that the device can be set on. The highest resistance should be the goal, as long as the patient doesn't get too tired too soon. If there's too much resistance, then decrease it by moving the indicator to the minus mark. Over time, the goal is to use the device at the highest resistance that your child can tolerate in order to get the most benefit.
Sit up tall.
To begin, have your child seated comfortably and with good posture to allow good airflow and movement. Place lips on the mouthpiece with a good tight seal. Instruct them to inhale a little deeper than a normal breath for about a 2-second breath hold, and then actively exhale, but not forcefully, 3 or 4 times longer than the inhale. Once your child understands the technique, the session can begin. Put the mouthpiece in the mouth and close the lips around it to ensure a tight seal. Inhale through the device, taking a deeper breath than normal, but do not totally fill your lungs. Hold your breath for 2 to 3 seconds before exhaling. Exhale actively, but not forcefully, through the device. Keep your cheeks flat and firm. Keep a good seal on the mouthpiece. After at least 5 breaths, perform 2 stacked Huff Coughs to clear your airways. A stacked Huff Cough is taking a deep breath in, holding for 3 seconds, and not letting the air out, but trying to take in a bit more air to push open the bottom airways. Take in a few more breaths before letting all the air out in a slight, forceful, and complete exhale. Stacked Huff Coughs can be done with or without an Aerobica.
Good. Now 2 coughs.
Steps 1 through 4 are considered one cycle. Rest until ready to repeat the steps. Repeat steps 1 through 4 for a minimum of 5 cycles and instruct the child to take their time in between cycles. The entire procedure should be performed at least twice a day on a regular basis and increased up to 4 times a day if you are producing a lot of mucus. You can also alternate this treatment with another form of airway clearance, such as hand CPT. The goal of this therapy is to keep lungs clear and increase ventilation. Continue to use these treatments on a regular basis, even if only bringing up a little mucus. Now, here's how to clean and care for your device. First, wash your hands. Now, break it down into its 4 pieces and soak it and swish it around in warm, soapy water. Rinse each piece. Then let it air dry. A little tapping or drying by hand may be needed to completely dry the small areas. Cleaning should be done after each use, and disinfection should be done daily after it has been cleaned. Here's how to disinfect it. Put the 4 separate pieces in boiling water for 5 minutes. Remove them from the water and allow the parts to cool and air dry completely before putting it back together. There are other ways for cleaning and disinfecting this device in the Aerobica user manual. In this video, we've demonstrated 2 methods for clearing airways: hand-chest physical therapy, or hand CPT, and an oscillating positive expiratory device called the Aerobica. Whichever method you are using, the goal is the same: to get the mucus up and keep the airway clear for children with cystic fibrosis. Use the method that seems most effective in producing a cough with mucus. For more information, or if you have any questions, please contact your respiratory therapist.